Okay, my speech. The River Jordan Medical Center opened its doors in 2015 here in Voi. It's a healthcare facility whose foundations and principles are anchored in the Christianity, tenets, and beliefs, and strives to manifest God's love to humanity. Currently, we have 3 branches. The hospital has grown to meet the healthcare needs of the larger Taita Taveta County and the neighboring counties around the coastal regions. Our branches are the main branch near Moi Hospital, the Maugu branch in Maugu Town, and this branch called the Premier branch that is based here in Karioko. Primarily, each of these branches has general outpatient services, inpatient admission services, maternity services, surgical services, laboratory, dental, radiography and imaging, nutrition and dietetics, mother and child health, immunization programs, specialist clinics, among others. We recently have added an optical unit and a dialysis unit, particularly in this branch. In a nutshell, the River Jordan, in this hospital, one gets assured of obtaining preventive, curative, rehabilitative, and promotive healthcare option 24 hours a day, 7 days a week. We are strategically located near Moi Hospital to provide an advantageous avenue to patients seeking alternative options. Ni wagapi wamewahi enda Moi na wakakosa matibabu na wakapata hiyo matibabu River Jordan? Tujipigie makofi. Asante. In fact, just recently we partnered with the Moi County Referral Hospital for referral services for patients in need of palliative care. By the way, we partner a lot with Moi. And we are not rivals with Moi Hospital. We are partners. Tunaobana chumvi. Ya ukweli? We borrow things from them. They also borrow things from us. They even wake me up at 2 a.m. in the night. Wananiambia shida zile wako nazo na ninawasaidia. Na pia sisi tukipata shida, tunawapelekea shida zetu. So never think that we are rivals with Moi. And I'm happy Murago is here. Murago, is that true? It is very true. Tujipigie makofi. We are partnering with government to provide health care for this county. Asanteni sana. The River Jordan isn't in the healthcare industry for commercial competition, but to empathetically offer more customized healthcare solutions even to the less fortunate in our region and beyond. The core objective of this hospital is to offer access to affordable quality health services, solutions, not discriminately. Unajua kizungu kilikuja. We believe no patient should be turned away to suffer for their incapacity to foot their medical bills. Tunasaidiana na kila mtu. Tunaona ni njia gani tunaweza tusaidiane. Upate matibabu ndio uweze na baadaye tunaweza ona vile tunaweza lipa hiyo. Tumesaidia hata wengine bure kabisa. We have seen patients here came in as emergency, we treated them, they walked away without paying a coin. They owe this hospital. One of them actually owes us $500,000. Na it's now more than a year since they were treated. Na bado hatuoni mwangaza. Lakini sisi tunaendelea. Na Mungu ako mbinguni anatubariki. Na hivyo tunaendelea. We have filled a room for negotiation for patients whose bills have been overdue. We have extended our corporate social responsibility to give out free medical and material and spiritual support to members of the public through free medical camps, free on-call, on-site health talks, humanitarian crisis responses. For example, when we had flooding in Voi, munakumbuka wakati wa flooding? We came in, it was which year? 2020. 2020 there was flooding. We were also called upon, we went to Kasaidia, because we are a corporate entity and we offer corporate social responsibility. We treat schools, school children, we go to orphanages, we go to prisons, we go to police stations, we go to wildlife conservancies. We are everywhere. We have made our presence known around 75% of this great county of Taita Taveta, touching lives in the process, and in the process this far. We have managed this through compassionate support from among ourselves, and sometimes we are the assistance of our partners on the ground. And we are always ready to partner with any entity and stakeholder within or or outside the medical fraternity. Workforce is now about 80. Tujipigie makofi. A lot of these staffs that are 80 and above wametoka hapa Taita Taveta. Sawa sawa? Bwana Chief, watu wenu ndio tunapea kazi kwa wingi. Watu wa Taita. Kwa sababu this institution is in Taita Taveta, it must benefit the common mwananchi ambaye anaishi Taita Taveta. Asante. We don't bring people. I have not introduced anybody here from Nyeri, where I come from. Mimi ni mama wa kutoka Nyeri, lakini sipigi baba. Lakini pia sileti watu from Nyeri County ndio wakuja ati ni waajiri hapa. Hata sidhani niko na watatu hapa ambao wametoka huko. Sababu tunaamini we must ensure that this county tuipeleke mbele. Sawa sawa? All our staffs are committed to solving our healthcare concerns, and that reflects in our immortal motto, here for your good. To extend our exceptional goodness towards mankind, we are hereby officially opening the gates of this branch, the premier branch, so as to cater for our patients' extra needs that include executive atmosphere. Nikisema executive munaelewa. Hapa hakuna hawa watu wengi sana. Sidio? That is why we call it premier and executive. Calm ambience, uninterrupted privacy. Our rooms are very private. We even allow you to come in with somebody ambaye anaweza pata pia kitanda pamoja tu hapo kwa sababu ya your personal support and care. Less congestion, meaning a superb turnaround time is guaranteed. Specialist nephrologist consultation, nephrology ni mambo ya dialysis, optical and ophthalmic attention, among others. We celebrate this milestone today because it's a prayer answered for our patients who have become, over the time, our most loyal clients. You asked for it, we have delivered. Let me tell you, when I arrived in Voi in 2014, my children were small. My firstborn then was in class 8. My secondborn was in class 7. And my thirdborn was, I think, in class 3 or 4 there. Alikuwa mdogo. In a span of 3-4 months, watoto wangu wakagojeka. Walipogojeka, nilishindwa nitawapeleka wapi. Nilienda Moi, nikakosa msaada. Na mimi ni daktari. Those days I used to work in West Hospital. Twice, we had to go to Mombasa as an emergency. Kwa nini? Hatupati msaada Taita. na watoto ni wagonjwa sana. So I was admitted kule Mombasa na watoto wangu wawili. I think I was admitted twice or 3 times. Na hii kitu ndio ilinisubua sana. Mbona Taita hatuwezi pata matibabu ya mtu ambaye hasikii ako sawa Moi au mahali pa government? Uko na pesa hazikusaidi. Unataka class hauipati. Unataka quality hauipati. And that is why we have come up with this branch of those people who can afford it but they are not getting the service. Who have the money, they don't get the service. You want space, you want your privacy, but you still are not getting it. We want you here now so that you don't feel this congestion. Hutaki ile msukumano iko kule nje, hutaki ile nini, unataka privacy yako. Na ukisikia unataka kupumzika siku 5, hizo ndizo tunakupatia. Kwa nini? You ask for it and we are giving it to you. Tujipigie makofi. To meet the dynamic needs of our patients, we have managed to partner with the National Health Insurance Fund, NHIF. We therefore are on the front line in encouraging members of the public to register their membership with this good insurance called NHIF. And this will make the River Jordan Medical Center the choice of every person in this county of Taita Taveta. NHIF pays for outpatient, for inpatient, for surgery, for maternity, for dental, for optical, for dialysis, for specialized management, and even for ambulance. Tupigie NHIF makofi. Alongside NHIF, we also have partnered with several other private insurance companies. That is corporate insurance companies. These ones are, I'll mention a few: AAR, Britam, Liason, Old Mutual, CIC, General Accident, Minet Insurance, AON, Takaful, the Kenya Alliance, APA, Sanlam, KCB Bank Assurance, Cooperative Bank, Madison, among others. Jubilee also. At the end of this year, we envision to partner with 5 or other more insurances that have not been mentioned, because we want to leave no one behind. We have friendly packages for private organizations. For example, we are partnering with faith-based organizations. Faith-based, for example, ACK Church, they are treated with us because they have a scheme that takes care of their clergy and their families. We also are partnering with another organization called Wildlife Works, because we go there, they are near our branch in Maungu, and you know the kind of work they do. They get a lot of injuries in the workplace. They deal with wild animals. And so they have partnered with us, and we are grateful. And so what are we saying? We are free to enter into partnerships with different companies, different organizations, so that we are able to work, even with the Taita Saison, Taita Estate, ile iko Mwatate. Courtesy of these partnerships, their members are able to access our unlimited service 24/7 without a problem. We welcome every corporate organization, self-help group, NGO, faith-based institutions, and the private sector to register their partnership with us so that we work together. Also, we don't want to forget our cash payers. A lot of patients are paying at our hospitals by cash. We have more flexible and personalized terms of engagement so that they don't suffer from the stereotype that services in the private hospitals are generally reserved for the rich. Medical attention is a basic human right, and therefore everyone must access it. We at the River Jordan have you covered. Kwa hivyo msione kama tu ni wale wako na kadi kubwa kubwa, ni wale tu wako na NHIF. Hata mama boga ambaye hana hizo kadi zote anaweza pata matibabu hapa. Bora tu tuelewane, tusikizane ni vipi ambavyo tutalipishana. Asante. Our future. It is the demand of the general public that inspires us. We started off in 2015 as a tiny facility, but with big visions. And here we are today. 3 branches in a span of about 7 years. Further, the demand from the members in the periphery is growing. We have now received calls from Wudanyi, Mwatate, Taveta, Makindu, Taru, Macnon Road in Kwale, all saying, bring your services closer to us. God willing, in the next few years, we will have added more branches. In my closing remarks, I would like to say this. On behalf of the board of directors and the management and the staff and the stakeholders of this hospital, I take this opportunity to express our gratitude and appreciation for honoring our invitations. Your presence here will never be taken for granted. Thank you for trusting us as an institution. Thank you, KWS. We have partnered with you a lot. I want to recognize everybody we have partnered with. The secondary schools around. We treat Mwagea, we treat Voi boys, we treat Voi girls, we treat, who else? Mwakishushu, kule juu Sagala. Children come from as far as Mwasere girls, Mwagogo, Mari girls, because we are in partnership with everybody. So we thank you for coming. We also thank our God Almighty for seeing us through. We have had many challenges, let me tell you. Don't think it has been a walk in the park. It's been very, very challenging. To put up these 3 branches, it is not easy. But we thank God it has been possible. We thank you for encouraging us. Badala ya kuongea mabaya yetu, mabaya peke yake, pia atupa mawili matatu mazuri. Si ndio? Najua tu hatujafanya kazi vizuri throughout, but know that we are a growing institution. We are making ourselves better every day, and come and tell us, hapa mrekebishe, hapa mrekebishe. We are free to discuss and to listen to you as our client. And therefore, we thank God and we thank you, and we hope that today you are going to have a productive engagement with us. Please feel free to be treated by our dentist. Feel free to be treated by our optical unit. Feel free to walk into our lab. Free to visit even the dental, even the optical, our doctors are here all waiting for you. Please, any day, have a talk with us, and we are willing. My number is a public number. I usually say, my number is a booth. Mnajua booth ni nini? Sinipala tulikuwa tunadaga tunaangalia tu. Hata KMTC wako hapa, Mr. Chege, nimekuona. KMTC are our partners also. Very soon we are going to have their students come and do practicals in our hospitals. That is a good milestone, isn't it? Asanteni. So I want to finish here and say, karibuni sana siku ya leo, na let's visit all our departments. Let's see how we are working. We are going to work together. I saw the chairman of the board of directors here. Where is he? I wanted to introduce one board member. He has walked out. I think we will introduce him at a later point. Asanteni sana na Mungu atubariki zote.